Hi, Gail. It's Shirley, and I wanted to put this little video together. This is a part of a presentation I did to motivate dental hygienists into practicing at a higher level. And I want to share it with you because there's a big segment in here that I've been using for quite some time, and the numbers are obviously bigger now than they were back then. But I'm really interested in getting an attorney behind this story. And it's mainly for people in care. And so the idea here is that there's no reason why we should expect these nursing assistants to to take care of the oral cavity when we as dental hygienists have at least 2 years of actual school experience in patient management, patient care, oral cavity, um, cleaning the teeth, why we have to clean the teeth, how to get in there without getting bitten or spit at, and have a higher level of confidence going in. Nursing assistants are underqualified for sure. They have 30 minutes of education in a 3-month program in how to be a nurse's assistant in a long term care facility. This government requires daily oral care, including flossing, which is impossible. And so, what I want to do with this presentation for you is to kind of show you where you can access more money for your patients that are underserved or being abused in these long term care facilities. When the investigators come through and grade all of the problems at a nursing home before they shut it down, the oral care piece is way past some of the things that they would be looking at. So, for instance, they may be looking at falls, they may be looking at dirty dishes in the sink or whatever. So, those would be in the top 50, let's say. Um, there's a special word for that, the top 50 problems at this nursing home. And oral care may be 52, but they only need two or three of those to be um, two or three of those top 50 need to be a problem. So by the time they get to the third thing, they've never even looked at oral care. So that's part of the issue. So we've got a few studies. Actually, there's a growing number of studies, but nobody's making money doing this. Nobody's really pushing this idea that we shouldn't be asking these 30-minute nursing assistants to be doing this care. So this was a study. Sorry, I don't have it listed on here. It's just so well known. Professional mechanical cleaning of the oral cavity rather than a daily chemical disinfection of the mouth can be an important strategy to prevent aspiration pneumonia in the dependent elderly. In this 2004 CDC survey, we came up with these numbers. So this was Angie Stone and I that did this research. There are 16,000 nursing homes. There are about 2,000 million beds. And of those 2,000 beds, there was an occupancy rate of about 86%. And that brought us to about 1.5 million residents in these facilities. In 2006, and I did have the reference down at the bottom, there's good evidence to show that improved oral hygiene and frequent professional oral health care reduces the progression or occurrence of respiratory disease, not just pneumonia, among high risk elderly adults living in nursing homes. Let's see here. The study continued to mention some of these modifiable risk factors for nursing home acquired pneumonia, which is one of the top leading causes of death. But everybody thinks this is a normal thing to have happen when professional oral hygiene can be a risk or a lack of professional oral hygiene can be a risk factor, a modifiable risk. This was a study in 2011 in the publication called Vaccine, Healthcare Utilization and Cost of Pneumococcal Disease in the United States. The direct medical costs came to $3.5 billion from pneumococcal disease caused by 4 million illness episodes. So we have this all kind of broken down on this. Most of the patients there were over 65 years old. In the study, they looked only at the people who were over 65 and looked at how many hospitalizations, emergency, outpatient, and deaths. So the direct medical costs were $2 billion. Dental hygiene care saves about 21% as a modifiable risk factor, as we saw in that other study. So that gives a potential savings because they're always looking at the money, right? Of over $370 million. So if you estimate the economic impact of a half-day reduction in the length of a hospital stay with those people in community-acquired pneumonia in the US, you could save between $400 and $800 per episode. The 30-day mortality rates are ranging from 10 to 30% in nursing home pneumonia, and the rehospitalization rate is as high as 20%. It was so bad that Medicare refuses to now pay for rehospitalization. So it's super important and super motivating for these people for these nursing homes to up their standards so that there is no rehospitalization of these patients. So that 20% there is complete negligence and should be held accountable. So the insurance companies have looked into dental hygiene practices. This was a 3-year study of over 3,000 people with diabetes based on the insurance, and those who received periodontal treatment saved $2,500 in medical costs, not dental costs. So those people with diabetes had fewer medical costs, almost $2,000 or almost $2,500. So by looking at just the small picture, we're losing money left and right, and we're losing people left and right. It's a stupid way to die. I would like to refer you to my friend Angie's book, Dying from Dirty Teeth, and it has a lot more statistics in it. It's also 5 or 6 years old, so we don't have a lot of current numbers. So this is here also from 2004 with those nursing home numbers, as I mentioned earlier. Of those 1.5 million filled beds, 30% reliably of those residents have some form of diabetes. So if we subtract 70% who don't have diabetes and just look at those residents that have diabetes, that leaves us with 450,000 residents who have diabetes. And if you multiply that just by the $2,000 that was saved per person per year on that Cigna study of out and about people, you can probably save a lot more than $2,000 in dependent people in long-term care. We can save $900 million in downline medical costs for diabetes. And if you divide that by the 16,000 care facilities, you come up with a savings of $56,000 a year per facility. And then the overall mean annual income from employment as a dental hygienist is usually about $46,000 per year. It's probably a little bit more. There's money left over in each of those care facilities. So that brings us to the point where it's cheaper for them to allow people to expire than it is and start new clients and get a new onboarding because that's pretty expensive for these care facilities, and you have to wonder what is really. We also know from this 2012 study, and I do have this one, it's from the Journal of Clinical Periodontology. It's called Oral Hygiene, Periodontal Health, and Chronic Obstructive Pulmonary Disease Exacerbations, that fewer remaining teeth, high plaque index scores, and low tooth brushing times are significant correlates of chronic obstructive pulmonary disease exacerbations, indicating that improving the periodontal health and oral hygiene may potentially be a preventive strategy against those exacerbations. So if you start to do a couple of more pieces of arithmetic, we start to see another extraordinary way that actual dental hygienists employed in each nursing home, can save lives, save money, save drama in these families. These families that have term care are really trying to fit in this extra piece of work in a normal workday. So if you're working in a factory, or even if, like you have these jobs where you absolutely cannot break away because you're in court or because you have a deposition or a thousand different things, right? Everybody has a job where they have to be at their job. You can't be just running off because your mother-in-law suddenly has a problem that stems from COPD, which really stems from a lack of oral care. Professional oral hygiene in this United Healthcare study showed that annual medical costs for people with COPD, these are out and about people, these are not long-term care people, saves over 1,000. More plaque on the teeth translates to a higher rate of COPD. This has been in the literature for some time. So we're expecting a 30-minute trained medical assistant or nursing assistant who can tell if a person's sock is off, but cannot tell that a person has dentures or not, is in charge of cleaning these people's oral cavity. So of those compliant patients, we saved money. Those are the patients that did brush their teeth and did take care of their mouth, saved a bunch of money. And in the people that are not able to clean their own teeth or take care of their own oral cavity, there was $7,000 saved annually in medical costs, not just dental costs. This is extraordinary that the American Dental Hygienists Association wasn't all over this and insisting at the government level that we have more access. I'm extremely disappointed that the American Dental Hygienists Association lets this kind of shit go. Compliant patients saved even more money, almost $8,500 annually. This study here, the intervention to prevent nosocomial pneumonias, which are pneumonias that come um, out of thin air, kind of, and we were able to prevent many, many different pneumonias totally in these dependent populations. This was in the Journal of Evidence-Based Dental Practice in 2014. This goes back to the study that we were mentioning earlier. These findings indicate that weekly professional mechanical cleaning of the oral cavity rather than daily chemical disinfection. So they would use one of those, they're called toothettes. It's a sponge on a stick. It looks like kind of like a lollipop. And they would soak that in a very caustic mouthwash and expect these care people, these nursing assistants, to go in there and swab the oral cavity when we already knew it didn't do any good, but they would at least do that more or less. This is probably off the here. Yeah. So we're looking this is the end of this presentation. Let's just skip over